Following a review meeting on the COVID situation in the state, Chief Minister Conrad Sangma today informed that the Health Department has been asked to come up with a draft standard manual or SOP to tackle various scenarios that the state might see in view of the pandemic. He also stated that the state government has started planning in case a third wave of COVID-19 is witnessed.
Of course, we don't know what's going to happen, whether we will be hit by third wave or not. We can't say right now, but all indications, keeping the history of pandemics in mind, we have seen that there are multiple waves. So, as a government, we need to be prepared for it. That's number one. And we're hopeful it doesn't happen, but that would not be the right strategy. We would need to prepare. There are 2-3 things which the government is working on. Number one, we are working on a COVID manual. What we've realized is that the cabinet and the officials and the ministers, we all spend a lot of time in discussing a lot of steps which need to be taken when situations unfold. Many countries, for different scenarios and situations, have a standard manual or a standard SOP as to what steps to be taken when. For example, when we touch a positivity rate of 10%, immediately there should be certain kind of restrictions that should come in. What those restrictions should be. What should be closed, what should be open. We realize in both the phases of both these waves, the government had to monitor each and every movement up to the micro level. So we feel that if we come up with a strong standard operating procedures, a strong manual as to what should be done at what point in time, when should the Corona care centers be activated, when should the volunteers be activated, when should lockdowns happen, when should containments happen, where it should happen, it will be easier for the government and the system and the machinery and administration to work. So in preparation of the third wave, first thing we're going to be doing is coming out with this manual SOP. We have asked the department in 30 days to give us a draft copy of this manual. We feel that it will strongly help us in fighting another situation as and when it comes in. At least it will allow quick decision making based on situations.
Responding to suggestion for universal vaccination made by Opposition Congress, he stated that if the Government of India allows and supplies vaccine to the state, then the state government is up for it. He informed that currently the target is to vaccinate 18 to 44 age group and that 66,000 doses for the group are en route to Meghalaya.
Yes, there is a kind of a theory that the third wave may hit children because of the fact that we're seeing the virus mutate every time. So earlier it was hitting the people who are 45, 50, 60 and above. And it mutated and it suddenly started hitting the people who are 18, 20, 30. So there is a prediction that now it will mutate again and it will go deeper into children who are slightly more stronger in terms of immunity because of different factors they're growing. So yes, there is a chance of that happening, and obviously the infrastructure requirement when it comes to children, especially when it comes to ICUs and all, is very different. So the kind of masks that they put on there, the kind of machines that are put in there, so all these factors obviously are being looked into. So we are going to be focusing on all these aspects, but the basic infrastructures like oxygen plants in all the districts and all the hospitals are something that will be common to all. So only the adjustment in terms of the few of the machines that will be required will be something that we need to work on.